The knee ankle area has been bothering me more off to the side and above. It bothers me when I go down, like going down all the way is a lot. Here is fine. It's a little crunchy, but like all the way, oh, I can feel that coming back up. Yeah, it's more going down and coming up. Walking does not bother me at all. Tightness, pressure, it's like the joint feels pressure here.
Out of 10, how much pressure?
A solid 5 or 6. Let's see, I think hamstrings are kind of tight too. Like a 4 or 5.
This is a LFCN, or your lateral femoral cutaneous nerve. So I'm just tracing the nerve up a bit higher through the thigh. A lot of the times we can have problems that are here and our symptoms will manifest down lower. This nerve can be trapped and not allowing her knee to function properly, and that's why she's feeling tightness, especially when she uses it. Good, bring her out, abduct the leg, good. And down. Good. Location-wise, she's feeling it more at the top of her knee, but on the outside, right? So what I'm doing is I'm releasing some of the nerves and some of the structures, allowing these to relax. This lateral femoral cutaneous nerve can be affecting her anterior thigh. It can be affecting some of the IT band here. And all of this comes down to about right here to where her symptoms are. So my goal is to allow all of this musculature to relax and then to function properly. So that way when she goes to bend her knee, there's not as much tightness or pulling. And then she could start to strengthen around this, so that way this doesn't happen in the future.
That one felt a little spicy. Feels like pressure, but also like I felt something nervy, maybe like moving slightly in a way that felt positive.
We use some shockwave on your IT band, right?
Yes.
So this comes from this bone here all the way down, attaches to the knee, and when this tightens up, this can affect your knee as well. This is really cool because I can feel this tissue just starting to soften as we're going through here. How's that feel?
Amazing.
So the hamstring on that left side felt tight.
Yeah, before treatment it felt a little.
How's the knee?
Knee feels lovely. Maybe 2.
So she's experiencing some tightness in this hamstring. Right now I'm treating her sciatic nerve in the back of her thigh, or AKA her hamstring. So even now, just the compressibility of her hamstring is much better. This tissue all feels softer over here. Still a little bit of tone or just involuntary contraction. Maybe some muscle guarding over here on the lateral side of her thigh. So tone can come from a few different things. A lot of the time though, it is this neural tensioning where your body wants to tighten up, either due to a nerve entrapment or it's trying to protect something, AKA your spine, a disc, an injury. And it feels like someone is basically like flexing, making this muscle, but they're not, they're just laying there relaxing. And that's just the body's way of trying to protect or get you to limit the amount of motion that is happening in one area. Very interesting how the body wants you to be as efficient as possible, but also wants to protect you at all costs. So that's how we end up with compensation patterns, and then we burn out muscles that aren't supposed to be doing certain actions, and then we end up with adhesion. Good. So same thing, I'm checking now essentially how our sciatic nerve comes out of our low back here and traverses down through the glute, comes down through our posterior thigh. Once it gets to about this point here, it branches out where one branch is gonna go straight down. It's our tibial nerve, like this. We have another branch, our common peroneal nerve, or our fibular nerve, that comes down, it branches off, and then it kind of traverses out this way, comes underneath this fibular bone on the side of the leg here, and then it actually comes down and branches into two more nerves that go down through the front of our shin and eventually end up in the top of our foot, while this one branches out and ends up in the bottom of our foot. So sciatic nerve, essentially from here all the way down to here. So we could have entrapments through any of these branches, through any of these sections that can be causing any type of tightness, weakness. I'm checking the similar nerves from back here. So sometimes when these get entrapped, and because this traverses through the posterior part or the back of the knee here, if she has an entrapment with that tibial nerve, it could be affecting some of the range with her moving her knee or some of that tightness. So I know she had symptoms that were more out here on the front outside portion of the knee, but same thing, the body's just, it's very interesting. And you know, sometimes when we have stuff that's trapped in the back, it can cause tightness and weakness in the front, or vice versa. And we spend a lot of time, this is a high usage area. We bend our knees constantly, and then when we sit, we're constantly, we have, our nerve is constantly in a state of contraction. All these muscles are in a state of contraction. So, you know, they sit like that for a long time. They tend to get stuck like that, or if we have any type of inflammation, once again, this is a huge, an area that's highly used. There's a lot of movement and wear and tear going on in here, so it's easy for adhesion to build up back here.
Yeah, much more nose, like
Still feeling that tightness?
barely.
1, 2?
One. Yeah. And that's, I mean, honestly, yeah, if I'm stretching regular, I feel like I was really kind of going in deep.